Being recorded, sir. So, good evening. I welcome you all for this session on introduction to how we are going to orient ourselves and prepare for the MRCPCH clinical exams. So, this is mainly meant for candidates who have passed the theory part 2 and who are awaiting their part 3 clinical exams. So, we are trying to help you how to crack these exams in a more relaxed manner and how we are going to approach the exams during your study time. Okay. So basically, we are from Chennai, India, and we are doing these sessions a few times in the past. So here we have our contact details. So basically, we are a group of 4 members working in pediatrics and specialty departments in Chennai. So I will start introducing Dr. Prasanna, sir. Sir is currently working as a professor of pediatrics in SRM Medical College in Chennai. Sir has experience of past 15 years and Sir has numerous grades to his name. He has numerous publications and he is also examiner for MD Pediatrics. And he is currently pursuing his PhD in pediatric pulmonology. Welcome you, sir.
Thank you, Dr. Sabri.
And let me introduce our speaker, the anchor for today's session, Dr. Sabrina. Sir not only has finished his pediatrics, he has also done his rheumatology. So he is specializing in rheumatology. His areas of interest is in immunology, allergy, autoimmune, autoinflammatory. So almost all the crucial cases in history, I think Dr. Sabrinath is well versed. So whatever history, commonly in MRCPCH comes in allergy, immunology. And also for MSK station, the go-to man will be our Dr. Sabrinath sir. So his expertise is very good. He is a keen teacher. Most often after the classes, the appreciation for sir will be too many appreciations will keep on going. So we are happy to have you, sir.
Thank you, sir. Prasanna, sir.
Good evening, sir. Good evening. Can you hear me?
Yeah, yes, sir.
Okay, good. I'm happy to introduce Dr. Balaji. He's my colleague, you can say my friend, colleague, and a philosopher. He's currently working as a professor in SRM, and it is one of the biggest. His biggest strength is he is in medical education for quite some time. So that helped him in breaking MRCPCH all records, all-time records by scoring 81 out of 82 in his final clinical exam. He is a gold medalist and he used to be a best student right from his college days and has numerous awards and publications. And his current field of expertise is pediatric endocrinology. So he's currently pursuing fellowship and PhD in pediatric endocrinology. So happy to be with us, and his field of expertise in teaching MRCPCH, he does everything good, and but he is a very well expert and master in development. So a lot of videos about sir in development domain is there. So and you can utilize sir. You can even ask for separate sessions in development. So I think if you are going to join the course, it will be very useful for you in all the domains.
Thank
Welcome,
you,
sir.
Thank Thank you.
Glad to introduce our next faculty, Dr. Harshavardhani. She's working as assistant professor in private medical college in Department of Pediatrics, and she's a faculty and speaker at various conferences. And she has numerous accolades to her name, and currently she is pursuing her interest in pediatric pulmonology. Welcome, you, madam. So, basically, the today's session is about the overview. Others, can you please mute? Dr. Deepika Jahar, can you please mute yourself? So basically, today's session is about the overview of the exams and how we are going to approach it. Okay. And MRCPCH exam, it's why it is different from other exams, because we have tried through MBBS days and MD days, we have run many exams. Now here the thing is, there is a time management. So we are going to be assessed in 5 or 6 minutes of time. And we have a short time for examination, around 6 minutes. But if you minus all the minutes after we are entering and giving the examination paper, it will be hardly 5 minutes. And you're going to summarize everything in another 3 minutes, and we're going to give differential and investigations. All those things are going to happen in 3 minutes. And here, whatever we're going to examine, we will be under the observation of the examiner, who is going to watch us how we are going to approach the patient. So that is may put us in an uncomfortable position. And here we need to keep talking, like we need to keep communicating to the patient as well as to the examiner simultaneously. And it's not a test of your theoretical knowledge, but how fluent and how methodological we are in our clinical skills and in our history taking and in presenting our findings. So that is what's being tested. And all these are going to happen in a short span of 5 to 10 minutes time. Okay. So then that span, it's quite different from other exams. And so it requires some amount of training as well as some amount of mentorship for you to pass exams comfortably, unlike other exams. So, so this is a circuit. I hope all of you are aware of this circuit. Some 10 candidates will be going through this circuit continuously. So the circuit will go on without any breaks. So like we will start from either of the station. It could be clinicals or it could be communication A or B, it could be video A or B. And we will be given a direction in which we are going to go through the exams. So this is going to go continuously. And all the sessions will be having 4 minutes for the preparation. And 3 minutes before the end of the session, there will be knock. The knock is a thing to remind us that only 3 more minutes are left. And we'll go through the stations individually. There will be real patients in clinical stations and role plays in other stations. And I will want to tell you that this is pretty organized and this is time tested. And so these stations will not have any problem with the organization. So it will go in a methodological way. And it will take around 3 years roughly. So this will also test our physics. So we need to be ready for those things. And this is the way we are going to be marked for doing examinations, whether we are meeting standard that carries 2 marks, and whether it is below standard means it's 0 mark, and in between it's 1 mark. And we are going to be assessed in multiple domains. The way we are going to take the history and we are going to communicate our clinical skills, our listening skills, and our management plan, everything is going to be tested. And the examiners have a pre-printed mark sheets, the way they are going to give us tick and score us individually 2, 1, or 0, depending upon the way we are going to perform. Dr. Hemant, please mute yourself. And few things are to be emphasized: hand hygiene and how we are going to cater to the patient, whether we are sensitive to the patient pain and discomfort, and how we are going to approach the patient. Are we going to ask the patient permission before examining them, whether we are going to keep them comfortable? So these are like very important things, and any wrong thing here will be like given a negative mark, so that will be marked as a below standard. Now, overall, if you see here, the way we see it, MRCPC is more of a test of your confidence and the test of your fluency rather than test of your knowledge, I would say. So for the fluency, you require practice, and for the practice, you require a good study partner. So we emphasize to have a study partner for preparation to MRCPCH clinical. And when you prepare the study partner, like one problem the study partner thing is we will not know what is wrong, where we go wrong, or where we go right. So in that way, you will also require a guidance from experienced mentors. So that is the place where we are filling up. And we would suggest you at least minimum 3 hours of practice per day, at least for if you're planning before 3 months of time, 6 months of time, you can take 2 hours, but 3 months at least you need 3 to 5 hours of practice per day. And for the clinicals, we would suggest you to see their cases and practice with your colleague the same time format of 6 minutes. And the clinicals, like only one book, if you could say, that's mark. Okay, so no more extra books are required. It's only mark, mark, and mark. And for communication, Rebecca will be a good to approach. And most of the questions, if at all, any theoretical questions, it will be from the guidelines and patient leaflets and other YouTube videos, WhatsApp group information. So these are all will be helpful to you. Now, reading a lot of information is not going to help here because, as I said, the time frame for theory questions are very limited. So there is a limited scope to test your theoretical knowledge here. It's more about testing your communication skills and how confident you are and how fluent you are in presenting yourself and getting the history and making the patient comfortable while examining. So all these things are going to fetch you marks. And rather than any particular diagnosis here, the emphasis on differential diagnosis and how we are going to approach the patient. Communication station. So this is the time frame. Dr. Prasna sir.
Yes, Dr. Sabri. I'm here. Okay, so the things that we need to know about communication station. Actually, communication station is one place where you can get full marks. You can definitely easily get full marks in the communication station. So this is how we are marked. So this is how the timeline goes. Outside, you'll get 4 minutes. You'll read the candidate information sheet, and then you have 9 minutes. There is no discussion with the examiner. You need not talk to the examiner at all. So you just have to greet the examiner, and you can start talking. Sometimes, in some centers or in some scenarios, the examiner may give you a brief statement regarding opening statement regarding the communication. But you have to fully talk with the role player. You have to fully utilize the full 9 minutes in the communication scenario. So by 6 minutes you'll have a knock on the door, and then at 6 minutes you have to by 6 minutes you should have finished all the discussion, and you should come to summarization. So and then you will ask the role player whether everything is understood, and all those things. By the end of 9 minutes you'll finish the station. Next slide, sir. So here the aim is to test the candidate's ability to communicate appropriately. See, the knowledge is not tested here. So sometimes the knowledge may be essential, but even if you don't know, if you don't know, the knowledge is not there up to the mark. The Royal College wants you to tell honestly. You are at the ST4 level, so you need to tell honestly that I don't know. I will come. I'll arrange a meeting at a separate time, or something like that. But you should not give any falseful information. Okay. So you will have a statement of what to do. The communication station will have your specific question. It will be given there will be your specific question there, and you have to address only that issue. So, for example, if you're in the communication station, I mean, Sabri, can you mute these people? It is very annoying.
Yes, sir.
Himmat, Rani, all these people they've opened their mic and they just.
I'm trying to
So,
mute, sir. Continue, sir.
okay. So, your idea is to talk. What is the role that is given to you? Your role is to talk to about. So you need not deviate from any the topic to any other thing. So for example, if you are supposed to talk about DMSA scan for a child with a UTI, then your communication station, in the communication station, you need not talk about VUR, you need not talk about UTI, you need not talk about the management of UTI. You just have to get their consent for DMSA. You talk only about DMSA. So many students, they do a lot of mistakes there. So these are some of the problems that you have faced in the communication. You just pour out your knowledge. So there are certain rules for communication. You have to talk less, and you have to allow the role player to talk. And they will assess your body language. The examiner will be sitting in the corner, and they will be assessing your body language, how you speak, what is your body language, how is your past, whether you are putting your empathy, sympathy, all those things will be in the, and whether you are not pouring the knowledge to the your role player. So the station is not a test for the amount of information conveyed. So this station is only to observe whether the candidate is able to convey what is given to them in an appropriate way and convince the role player. So here there is no any need for asking history, all those things in this communication station. Can you go back to the previous slide? So I'll tell them what are all the communication stations that they can. Previous slide. The communication stations, type of communication station. Yeah. So these are all the patterns, usual communication stations that are given to you. It may be an information giving, or it may be breaking bad news, or getting a consent for a procedure, or talking about to them about a critical incident that a wrong drug has been administered, or something wrong has been done by your colleague or nurse. So you have to accept that. And then you can even talk about ethics. A nurse or a junior colleague may be upset because of the way we treat the child, or you have to educate. You can talk. You may need to talk about an audit, or you may need to talk about explaining them your junior colleague about something. So all these points are the types of communication scenario. So you'll be having two communication scenarios. So there are one set of easy scenarios, means information giving and all is easy scenario. Talking to a teenager, talking to a colleague, all these are all little difficult scenarios. So you'll have one easy scenario, one difficult scenario. Even Breaking Bad is a difficult scenario. So you need to finish those things in time. Can you change it to the next slide, sir? Next slide. So there are two stations, and it involves a role player. The role player may take a role of parents, or an adolescent, or a medical student, or a training. Next slide. So this is how they actually see in this. If you see for the communication scenario, they will be marking you for the information sharing. Uh, the information sharing carries only 2 marks in each station, whereas your rapport and the communication style, your verbal and listening skills, and then your managing concerns and agreeing to the next step. See, if you see this per station, information giving is only 2 marks. So your communication style and rapport, your listening skill. So you have to allow the role player to talk to you, and they will have some hidden agendas. So you have to unearth the hidden agendas. and then you have to manage their concerns adequately. So these three will give you 6 marks. So there is very less knowledge is needed for the communication scenario. So even if you don't have adequate knowledge also, you can finish your communication scenario and still you can get 8 marks from the communication scenario. Next slide, sir.
That's it.
Come.
Others kindly mute yourselves.
Sir, you can mute, sir. You are no host.
Dr. Pritam Meena,
Oh,
not able
sorry.
to mute her. Please mute yourself. Yeah.
Okay.
So
Next.
So the next station is the video station we are going to see today. So I would
Yes,
say
sir.
video station is pretty easy station. So here there is no patient or no role player. And we are going to wait outside the station for 3 minutes. And usually 4 minutes. Usually there will be not much scenarios given outside. So we are just listening whether it is an only video or video with audio. So that is information we are given. And after that, we are going to listen to the video for 3 minutes. Okay, usually the video runs for around 1.5 to 2 minutes, sometimes even less. So we can view the video multiple times as you like. And after that, there's a discussion for 6 minutes. Now, if at all we are going to read theory from the guidelines, and it is going to help only in this station. Okay. So other stations, it is more of approach and more of how we are going to conduct ourselves, as Sarah was saying in communication. So here, the theory knowledge from the guidelines will help you because most of the questions are from the guidelines. So they will ask only questions from the guidelines. They will not go beyond the guidelines. And here again, we are not expected to remember any fine details, any fine that goes something like that. It's not required. So whether we have a differential, and after the differential, the examiner gives a prompts with the hypothetical diagnosis, and then they're going to go with the investigation and management of that differential. So this will last for 6 minutes. So this is a pretty easy session for reasons because it's like it will reflect on your knowledge and guidelines. And second thing, a lot of repeats will happen in this session. So if you read the repeats, then this is going to help your video session. So you have 4 minutes outside and 3 minutes for the video and 6 minutes for the with the examiner. Okay. And generally, if you see here, the video session is meant to cover stations which cannot be replicated in a real life clinical station. So infected cases and emergency acute cases and scenarios where there is patient discomfort is involved or it's a rare scenario, this could not be brought in the clinical station. Okay, so the purpose of video session is to assess us in these scenarios. And generally, if you see the marking scheme for the video station, it's 6 marks. So for the identification of clinical signs and whatever clinical signs they're able to pick up from the video, that carries 2 marks. And reasoning for the whatever signs we have picked up and arriving at a differential diagnosis, that carries again 2 marks. And after the examiner gives a prompt for the probable diagnosis, and then what management you're going to do for that diagnosis, that carries 2 marks. So it's very pretty simple. So this is one station where we can score full 6 marks out of 6. Okay, so if you're going to able to meet standard, we'll get 2 marks for all the 3 stations. So next about history station. Over to Dr. Balaji, sir. History. Or shall I cover, sir?
You can cover.
Yes. So history session, the waiting time is again 4 minutes. In history session, again here we'll have an information sheet. So about a brief information about what is about the scenarios. So then we will have 13 minutes inside. Okay. And 13 minutes, after 9 minutes, there will be a prompt. Okay. So that shows that there is only 4 more minutes left. And after that, there is a 9-minute discussion with the examiner. So this is one station where we have some roughly 9 minutes with the examiner to discuss. So here the examiners will ask questions about the case and about the management. Okay. And what is expected in a history session? So here we are going to take a focused history. So because we have 13 minutes, we need to take a focused history as well as we need to do a system screening of all the systems. And particularly at the end of a history session, we are not expected to give a diagnosis. We are expected to highlight the problem areas. Say, for example, in some cases, there is a history of V's and a known case of an asthmatic child. That's a scenario. Then the diagnosis will be pretty obvious. So our role is to identify the problem areas. Maybe the child has some difficulty in using the inhalers at school. Maybe the child has comorbid allergic rhinitis. So it goes like that. So the aim is to identify the problem areas and summarize all the positive findings at the end of your 30 minutes and formulate the plan of management. Overall, if you see here, we are assessed whether we are being a safe doctor in taking history or not, whether we are highlighting all the negative points which are very important. Say, for example, in a case of an asthma, like whether there is any history of anaphylaxis is there. So all those things which are meant to assess whether we are a safe doctor or not. That is the whole crux of the history session. And what is not expected? We are not expected to take a comprehensive history. It's obvious that we can't take a comprehensive history in those 13 minutes. And exact diagnosis is not required. We are going to give a differential diagnosis and summarize the problem areas and not to tell or repeat again the whole history again. So summary should be a neat summary. Again, in the management, overall management and overall the consultants with whom we are going to liaise, the team we are going to have a follow-up, and what are the basic principle of management is required rather than telling about the specific drugs. So specific drugs dosage, they are not required for the cessation. And if you see the history session, there are some few set topics which are being repeated multiple times. That's seen in the slide. Basically, if you see, there are two approaches. One is where you have we are going to get a diagnosis at the end of your history, and then we are going to approach the session. So, for example, if we have 13 minutes, here we would suggest you to have 9 plus 4 minutes, like 9 minutes for the history, to have a detailed history to ensure that we get a proper diagnosis, then 4 for the remaining part of the family, other part of the history, socioeconomic, those things for the next thing. In some scenarios where the diagnosis is pretty obvious, so the mother will say that the child is a known case of, for example, a type 1 diabetes. Okay, so here our approach is quite different. So here our approach is like more into the problems in the type 1 diabetes, as well as what is the current issue that the child is facing, whether he is having any difficulties in school, whether the complaints is for because of any financial issues. So here it is more of a chronic case scenario. Okay, other complications of diabetes that this child is having. So that is the approach here. So here we would suggest you to have a different in timings, like 7 plus 6 minutes. So all these we will tell you in our class. Okay, so the thing is, can be two cases where we are going to, one is where you're going to have a diagnosis, and in second cases where the diagnosis is pretty obvious. Here we're going to list the comorbidities or the problem areas in for this patient. And the duration, how we are going to allot 13 minutes is going to be different. So we will all help you with those things in our class. And if you see the marking scheme here in history, it is about, if you see the 13 minutes, whatever history you're going to collect, that will information gathering, that will get you 2 marks, only 2 marks. But the other problem, like the clinical reasoning, the management planning, the communication style, all these things will carry more marks. So the initial part of history is important to get the diagnosis, but as well as the communication style, the reasoning, the management planning will get you the full marks. So this station totally carries 10 marks. Okay. And this is one of the longest station in MRCPCH.
Thank you, Sabri. And a few points I would like to add for each station. Actually, in communication, actually, sir was saying the importance of communication style, rapport. Now, so the candidate, I think, got audit cycle. The topic was audit cycle, and the candidate didn't knew anything about audit cycle, but he spent the whole 9 minutes about. So the examiner was looking into the communication style and rapport style, and at the end, if you are honest to say, I will get back to you by looking back about the topic, and you should accept that. If you don't know, if you accept, you can easily score. He easily scored up to 6 marks, may not be 8 marks, up to 6 marks he got. So that's the importance of the way you communicate, how you build the rapport, how you are actively listening to the role player. So that's very important. And regarding video, as sir says, it's mostly the repeats. It keeps on the one domain, one station where you keep on getting repeats. If it is worth doing the recalls, I think it is the video station. And all the questions will be coming from the guidelines, from the UK guidelines. Maybe we'll share you the book. So all the questions, if it is in the guidelines, they will ask you from the guidelines. You are expected to answer, and you answer the guidelines, you score full marks as sir said. And regarding the, it is going to be the most toughest. You need to do a lot of preparation because of the wide number of scenarios and the largest amount of time you are going to spend with the examiner. Almost 9 minutes you are going to spend with the examiner. He is going to grill you all the questions. It's like staying in the lion's den for almost 9 minutes. So I feel it's a bit challenging. You have to be thorough in your history station. So you have to practice a lot the history stations. And regarding, yeah, we will move on to the clinical station. You can go to the next station, next slide. So clinical station, it's a short clinical stations. So we will be having 4 clinical stations. And this is the one place where we will be having real patients. Previously, development station used to have real patient, but now the development is a simulated one. There will be no real patient. History has a role player. Communication has a role player. Video is only video. So real patients you will be seeing only in the clinical station. So there are 4 clinical stations. So each will be, it is a short station. Each will be 9 minutes. So this will be the split up. Outside, you will be sitting outside 4 minutes. So this is the place where you can maybe organize your thoughts or anything. But clinical station, there will be nothing outside. You will not even know whether it is a CVS station or a CNS station. You will not know at all. So it will be only written station 1, clinical station 1, clinical station 2. And so outside, you will not know anything. As in communication, there will be some information outside, but in a clinical station, there will be no information outside. So once you enter inside, only once you hand over your mark sheet, the examiner will give you a task. So he will give you 10, for example, like here, in walking. So do a motor system examination. You have to listen to the task very carefully, or it could be a MS examination. It could be a motor system examination as a general, or motor system examination of the lower limbs. So depending upon the scenario, you have to be very careful. What is the task, and stick to the task. If you are going to do the upper limb examination, then you might be penalized also. And most important, you will not have the time. So here, time is the main problem for the examination. Out of 6 minutes, you would have gone already by giving mark sheet, by learning the task, and you're going to introduce yourself, you're going to introduce the caregiver. So this itself will consume your 1 minute plus the introductory statement. Okay. Then you're going to do a focused examination. Because of the time constraint, you're not expected to do a detailed examination. So whatever the examiner says, you're going to do the focused examination. So you need not be detailed because of the time constraint. Sometimes you cannot measure the blood pressure also. Although in the regular examination you do measure the blood pressure, here you may not be, it might not be possible. So you have to tell and do a Tanner staging of his sexual maturity. So like that, at the end, you have to say, I would like to complete my examination by doing this, because you cannot do everything in that 5 minutes. Okay. And you're going to the relevant examination. So the examiner will be checking your system whether you are systematic in your examination. That comes only by practice. So you have to keep practicing the clinical stage again and again. Then only you will be able to finish off 5 minutes. Okay. And so the examiner will be looking at your systematic fashion. Okay. Next slide, Doctor. Next slide. So this is how the stem. So Anita, she is 14 years old, has difficulty in walking. Can you please undertake a peripheral neurological examination? Can you examine the abdomen? So this will be the task. Next slide, Doctor. Okay. So you can go back, Doctor. You can go back to the systems. So they are looking into the systematic examination. Then whether you are identifying the proper clinical. So you do the proper clinical signs. Then at the end of 6 minutes, you have 3 minutes of discussion after the knocking bell. After you do all the examination, you have 3 minutes. In the 3 minutes, you have to do the summary. Within 1 minute, so clinical fast. So time have to then 1 minute you have to do all the summary. Then examiner will be asking maybe 3 questions at least. So what is your differential diagnosis, and how will you investigate, how will you manage, and what are all the advice you will give to the patient caregiver. So like 2 or 3 questions he will be asking in those 3 minutes. So you have to prepare what you are going to talk within 1 minute. So that is the key here. You might be knowing a lot thing about thalassemia. Suppose it's an abdomen case, you might be knowing a lot of about thalassemia, but you have to tell within that 1 minute the investigation within that 1 minute. That comes only by practice. Practicing all the scenarios is very important. Okay, and here in the initial start examination is all very important. So they look into hand. So whether you are doing the hand hygiene, whether you are introducing yourself, and whether you are building rapport, and whether you are sensitive to the patient needs. Okay. So I remember actually Dr. Prasanna was saying one of the candidates, the washroom. The patient said, I need to go to the washroom. And we will be a bit nervous now. So within that 5 minutes, we have to do the examination, and we might tend to do the examination in spite of the patient's discomfort. So that you should try to avoid. So you should try to avoid discomforting the patient. You can ask the examiner, sir, he needs to go to the washroom. Then what the examiner said was, had you examined, then I would have pleased you. So the comfort of the patient. So the whether you are fluidic examination, okay, and whether you are able to pick up the signs, whether you are giving a analysis, and whether you are able to answer all the questions. For any case, you will get a CVS station. Usually, you will get an abdomen station. Usually, you will get a neurological station, and you will get a others station. In others, you will get a you can get ophthalmology, dermatology, nephrology, MSK. Okay, you on the way usually react and abdominological. You might get a musculoskeletal or an ophthalmology case or a neurofibromatosis dermatology, or sometimes a syndrome or a rickets or a short stature. So like that you'll be getting it. Okay. Okay, doctor. So it is station one is the real betting. So online teaching might help you in communication, in history, in development training. With regards to clinical, only the you can discuss, but picking up all the clinical science, it all depends upon how many cases have you seen. So it's always advisable to see cases while preparing. Okay, otherwise it's going to be very technical. Okay. Okay, so this is how the marking scheme for clinical station. You will be given marks, 2 marks for the physical examination, 2 marks for the science, 2 marks for the clinical reasoning, the differential diagnosis, and 2 marks for the management planning. Okay, and okay, doctor, you can move on to the next. Okay, so then the last one is our development station. Okay, doctor, next station, next slide. Okay, so development station is station, and it is a long station like history station. And I would say it is a good thing that there are no patients, because in development, suppose you have a delayed development, it's very difficult to assess the development. Okay, so it's a long station, and there's one station which you get lot of marks is development station. So you get around 12 marks for the development, but for history you get only 10 marks. So the highest amount of marks you get in development station. And development station is one station which so far it's a bit uncomfortable, because we don't do it regularly on a daily basis. Okay, and you don't get it in any books like clinical examination pattern and all you have. So development alone you don't get to see in the books, because it's very unique for the MRCPCH. So they have a format and you have to follow the format. If you don't follow the format, you will lose a lot of marks. If you follow the format, you can get full marks. So it's all about the practice. Development station alone is all about practice. So you keep practicing, you can easily score 12 marks. You don't practice, you don't have any clue what it is, and you're going to lose all the marks. Okay, doctor. So, so can you show the station breakup, doctor? Yeah. So I would like to tell that there are two. Can you show the station breakup, doctor? The time breakup, doctor.
Yes.
Okay. So the time breakup is outside 4 minutes. There will be a stem written. Not much will be written. There is a concern that the child is not speaking well. The name of the child will be there. The mother's name might be there. And they will be asking you, the GP might be asking you to assess the child. Then they will write, kindly do a social and language assessment, or kindly do a fine motor and motor assessment. So you're going to assess those two domains. So either it may be a fine motor or motor domain, or it might be a social and language. So the instruction will also be clear that you're not supposed to ask questions on those domains. So suppose yours is a social and language, you're not supposed to ask questions in the history part regarding the social and language. So you have 4 minutes time. So that is the very important time. So write down what are all the questions you're going to ask in the history. You will be having a paper. So write down all the points. Then you write down all the milestones which you will be asking, because its development is all about the milestones. So you have to, it's like a tables. So you have to remember all the milestones. When will the child stand? When will the child walk? When will the child make a tower of cubes? So all those things you have to learn it as a tables. So we will be training you in the beginner's course. Then you have, once you enter, you have 9 minutes with the role player. So with the role player, you are going to ask a proper history. It is going to be shorter than the regular history. 15 minutes. So here is 9 minutes. So you have to be very focused in what you're be asking. Like a history may not be helpful in the development history. So you have to be very specific in what you're going to ask. For example, you might be asked so two things actually. We need to do the age for the child, okay, and we need to do the neurological diagnosis.
Sir, your voice is
Sir,
breaking.
your audio is voice is breaking, sir.
ਕਰੀਮ ਨਹੀਂ ਦਹੀਂ ਕਰੀਮ ਨਹੀਂ ਪਾਣੀ ਕਰੀਮ ਤੇ ਨੁਕਸਾਨ ਹੈ ਕੀ ਹੋਇਆ ਕੋਈ ਤੈਨੂੰ ਕਮਜ਼ੋਰੀ ਹੋਈ ਹੈ ਹੋਈ ਹੋਣੀ ਹੈ
Am I audible, Dr.
Others
Sir?
kindly. Yes, sir. No, better, sir. Others kindly mute yourself.
Yeah, my internet is a bit unstable. Kindly bear with me. So you have only 9 minutes, and even that 9 minutes, at the end of 6 minutes, you will get a warning bell. So you will be asking how long is the problem? Is it worsening? Then is there any behavioral problem? Okay, any problem with the hearing? Any problem with the any skin lesions? Any special faces? Any dysmorphism? Previously, any going on? Chronic problem, who are the teams, what is the, so you have to be very much specific to the neurological diagnosis. Similarly, the birth history is very important. So birth history at the time of delivery, any issues, so these are all relevant to the development. So you have to ask questions relevant, so that is very important. Then also there will be a background social history. There might be a problem in the finances, there might be problem in the family, sometimes neglect might be the cause for the development. So you have to ask those specific questions within that time. And believe me, if you a bit deviate from the number of questions you're going to ask, you're not going to finish nowhere near. Okay, in addition to this history, you're also going to ask few questions relevant to the other two domains which has not been asked. Suppose I have asked about social and language, you're going to ask 2 or 3 questions related to the fine motor and the gross motor, so that finally you should be able to say whether it is a global developmental delay or a isolated developmental delay. Okay, then at the end of 9 minutes, you have 1 minute where you will be summarizing the key findings in the history. And once you summarize, the role player will go out of the room. Then you have 9 minutes to do the developmental assessment. So that's a step-by-step assessment where you are going to enact a role play with the examiner. So it's a simulated kind of environment. There will be no real patient. You are going to enact how you are going to do the assessment to the examiner. Based on your way of assessment, the examiner should feel that you will be able to confidently do the examination. So that's more important in the assessment. So there are two important cues, the dependent cues. So dependent cues means you ask the right question, the examiner will give you the answer. For example, I will choose a blocks and see how many tower of blocks the child is able to make. Only when you ask the right question, then the examiner say, yeah, he is able to build a tower of 6 cubes. Then you have to write down, okay, 6 cubes, it's around 2 years. So the developmental age is around 2 years. So like that, you have to ask the examiner, he will give you the dependent cues. Universal cues are something which will be there when you enter the room, outside whatever is written. So that will be the universal cues. Okay. So you will be doing the assessment one by one. And before doing the assessment, just like a clinical examination, you will be doing the basic general examination, whether he is small, how is the actions, whether he is autistic or not, whether he is unilateral handedness is there, whether he is hemiplegic or not. So those initial assessment you will be doing, the hand hygiene, the permission, all like a clinical station you will be doing. Then you will be doing the assessment. You will be telling what are the toys you will pick up. So they have a set of toys which you will pick up. So you will tell what are the toys I will pick up. Then you will be giving those toys one by one to the child and see what is the child doing. Here examiner will be the child. So you will be showing it to the sir, I will show him the cubes and see how much cubes he will do. I'll give him the crayon and see how he is holding the crayon. I'll give him the crayon and see what he is drawing. I will draw and show and see what he is drawing. So like that, you keep asking one by one by one. And the domains which, can you go back, doctor? So the domains which we are assessing, can you, these are the toys. And gross motor, fine motor, speech and language, and social. These are the 4 domains. So you'll be asked any 2 domains for the assessment. Okay, next, doctor, the marks, final marks. Yeah,
Yes.
back. One. So this is domains. So you will be given marks for how you are taking the history. And finally, what is your clinical reasoning? What is the neurological diagnosis? What is the developmental age? That for that you will get marks. Then management planning, how you are doing, and everywhere the communication style, whether you are listening to the role player, whether you are okay, the patient, I'm really worried, doctor. You have to empathize with the role player. You cannot just keep on asking questions. I can understand that. And okay. So, overall, the
Your audio is breaking. So one thing about the development session, which I would like to give my feedback is, see, many students confuse between history and development. In history, you have 13 minutes for history session, but in development, you have totally 9 minutes. Okay, so you have totally 9 minutes in development, whereas in history, you have 9 plus 4 minutes. So your history in development should be very precise. And unlike the history taking session, here system screening is not much given importance, but asking very pertinent question with respect to the development issue is recommended here. So there is a bit of slight change in the way we are going to ask history in development session compared to the development session. And as Sarah was telling, if you are not asking the right question, there is high chance that we will be missing this bus. And again, if you see here in development station, the information gathering is fetching you only 2 marks. Okay. So whatever information you're going to get in those 9 minutes, that is going to fetch you 2 marks. Your way of identification of your clinical science from the examiner who is going to act as a patient, and the clinical reasoning, management planning, all those things will fetch you marks. Your rapport and communication style will fetch you marks. If you see overall, this is the one station which is going to give you 12 marks. Okay, maximum marks in the MRCPCH circuit. So this is one station which is going to fetch you maximum number of marks. And I would suggest you that like people who are going to appear for the exams, have a printout of your development domains in your room so that you see that daily. Okay. So the milestones should be given with a plus or minus of 3 months, a maximum of 6 months allowed in elder children. For infant, it should be 3 months. So try to have the milestones in your memory ready-made so that you will not have that stress of remembering those things in the examination. Okay. So see those milestones daily. So have the paper printed in your study room or wherever you're going to see that daily once. Okay. So see the daily for 3 months so that at the end of 3 months, you will have those milestones ready in your mind. And try to practice with your colleague for this station because this is one station where you're going to ask questions. We have limited time to ask questions, but we have to ask the right question. As I was saying, if you don't ask the right questions, then there's a high chance that we are going to miss the station. Any other suggestions, sir? Other mentors can
I
give their
think
inputs.
we can take some questions.
Yes, yes, sir. So this session is now open to all. You can unmute yourself, and if you have any specific doubts, we are happy to answer.
And we are starting a beginner's course where every week will be from scratch. So we'll have how each session is taught. We will have sessions. Most important, we have practice sessions. So by the end of like if you're planning for February exams, so you'll be exam ready. So you have to start early, not at the time of allotment. If you get allotment, you will have only 1.5 months. That might be very short time, and you will panic. So most important is practice. Start practice early. So you can contact us. We have our beginners course where all our 4 experienced mentors will be handling the sessions station by station, proper approach, and all the tips and tricks we'll be sharing, and we'll be practicing all the repeats. Most important, the recalls, and you can always contact us. We are happy to help you out. Any doubts you can tell now.
Hello. I
Yes,
want to
yes,
ask
Doctor.
a question.
you can
Yeah.
I
stop
want
the
to.
sharing, Dr. Sabri.
Can you hear me?
Yeah, yes.
Yeah.
Yes, you can ask
Yeah,
your question. Yeah.
I want to ask this question that I am from Pakistan. So, in stations where there is actual patient there, so will those patients be from our country or not? And if we will interact with them in our own language or in English language, will they able to understand? Like if we ask them that if you are having any pain or not, what would be the case there?
Yeah, doctor,
So,
patients will be from the center if it is in Pakistan. So the patients will be from the hospital only. So they are conducting, if the exam center is in a place, so the patients will be the patients who are coming to that hospital mostly. Okay, so it will be your local language only. And remember, clinical station is one where you are not penalized for the way you talk. It's about all the examination style only. When you look into the marks, so how you are picking up, how you are doing the examination, how you are picking the signs, how you are discussing management. So those things only you are given marks. And actually, you can even ask for a translator if you don't know the language. Actually, they arrange for translators. If you are, you have to send the mail ahead. Actually, so they will arrange translators, but not needed actually. So it will only delay your time. You have only 5 minutes, so you cannot keep talking to the translator. Okay, can you tell him? Tell him. No need to. You are expected to only do the examination, learn few words. For India, it's a major problem. So we go to West Bengal. So there most of the patients are Bengali. Maybe 1 or 2 words you learn from Bengali and you do that. Okay, Dr. Sabri, you want to add something?
yes, sir. Like I think in only 4 clinical stations we are going to deal with the patients. The rest of the stations is going to be in English. So for the clinical stations, it is like as Sarah was telling, just like 1 or 2 words like hello, good morning, thank you. So those things should be enough. And I think most of the signs will be like we can tell in the sign language. Like, say, for example, clubbing, you can show like this. Often, like before we are going to touch the patient, we are going to show them. So we will tell this all this approach in the clinical sessions. So most of the times, like we can tell them how to do those things. We can show them, and then we'll be able to examine the patients. And if you're not sure of the language, I don't think the examiner is going to penalize you for that in a clinical sessions. And he'll be understanding those things. But the only problem is if you are able to make the patient comfortable and the patient is not in distress, then you are safe. So whether the language is not one, that's not an issue, but whether the patient is comfortable or not, that should be the primary motto.
Thank you.
Any other questions to ask?
And I also want to ask that how much time is required to prepare for this exam, because I'm already into training. It's my third year, and I think that we have good skills, but somehow it's not streamlined. So for a person who is already doing training in their home country, how much time is roughly required to appear in exams?
Okay. So to answer you very exact, it is varies according to how much the individual is skilled. Okay. But if you are working in pediatrics for the last 3 years, then and you're currently working, then that should be fine. And all that is required is to have a colleague with whom you can practice. Okay. So you need to practice daily, and you need to have a mentor, probably somebody who has finished MRCPCH, who will be able to tell you where you are right and where you are wrong, and what is your strength and weakness. Okay. So that feedback will help you. Along with that, practice daily, that will help you.
Okay,
So
thank
probably
you.
if you are in 2-3 years of training, then maybe if you are skilled, then 3 months to 6 months is a good time for you to practice and settle comfortably.
So the key
Okay.
is don't wait for allotment. So start saying early, because you get out, then you'll have only that's very short time actually. Dr. Harsha, are you there?
Yes, any doubts?
Yes, hello, sir. Good evening. Good evening, everyone.
Harsha, you want to add any points?
Yeah, I think you both gave such detailed information, both Dr. Sabari sir and Dr. Balaji sir. Just that one important thing is practice, practice, and practice. The more you practice a variety of scenarios in front of mentors, especially, so that they can, give you the right uh, comments and feedback, the more you'll gain confidence to face the exam. The main thing for this exam is practice. How many ever times you practice a scenario, that much it will be useful for you. You'll only realize that once you go and face the exam. Until then, you won't realize how big and how much contributing practice can be.
Thank you, Dr. Harsha.
Okay.
Any other questions, or we close it for today?
Yeah. And regarding the pass mark, one important at the time of exam, out of 82 marks, we have, like, you are assessed on 41 domains. So out of 82 marks, we have to score 62 marks. So the thing is, we have a 20 marks buffer. So even if we don't do one station that well, still we have a good chance of passing the exam. So most important thing is we should not take baggage of one performance to the other station. So that's what sir has written. So don't take baggage. Okay. So you have done one. Okay. Don't worry. Many times you feel that you have not done well, but you will get good marks actually. So don't feel that way. Many times examiner will be sternly looking at you. You feel that the examiner was not happy with you, but examiner will give you good marks. So don't think about that. Once finished, move on to the next station. Perform it very well, the other station, because failing in one station alone, you're not going to fail. Okay. So you have almost 20 marks. So even if you don't do well in 2 stations, still you have a good chance of passing. So here is the example which I have given. So even if 1 station you got 0 marks, one station you got only 4 marks, and all the 3 stations you got one mark less. You're good in most of the thing. In video station 1, you got 1 mark less. Still, you can pass. So that's the key here. So don't get upset by 1 station performance.
Sir, for the clinical examination, do we need to take the instrument like
So usually,
MR?
other than a good stethoscope, you are not required to take anything. Uh, those tools will be there. If they feel this needs to be done, those items will be kept on the table. So that in fact it's a clue. Suppose whatever it's there, it means you are expected to utilize those instruments in doing the clinical examination. Suppose there is a stadiometer, then it's a short stature, you are expected to measure the height. At least at the end of the examination, do the height. Okay. So you need not take anything else except for a good stethoscope. Even stethoscope they usually give, but I think it's not of good quality, because in CVS you need to identify the murmur. So have a good stethoscope with you. You can go your hall ticket, go 1 hour early before the session.
Any further doubts?
Can you please tell that who will be the examiners in the local stations, like in India and Pakistan? Will like you people have passed this
So usually
exam?
it will be a
So
mixture, yeah. So it will be a mixture of people from UK as well as from the local region. So you'll have examiners from, if you're taking it to India, it will be a mixture of examiners from India as well as from UK.
okay, so they
Sir,
are
I
mixed.
am
Okay.
planning for giving the exam for Oman or UAE. So then the examiner will be from Arabian.
Usually it will be a mixture of the people from the local region as well as from the UK.
Okay.
But local, those who have passed the full training, like they have
They have
done
passed, and there's a
FMCPC.
special training for people who are appearing for as an MRCPCH examiner.
Okay,
So
okay.
there's a separate training for that. So people
Actually,
who have done through that,
when you are attending
they
the
will be
exam, there will be one examiner, and there might be 1 or 2 examiners sitting and observing.
observing. Yeah.
So they're actually in the learning stage for the next session. So they have a good
Okay.
training process. They don't just some examiner come inside and start doing assessment for you. So unless you complete the MRCPCH, unless you do the training for the exam, they don't keep you as examiner.
I think MRCPCH is more objective way of assessing yourself. So here you have very clear marking system 2, 1, 0, and here they have very much defined for what you're given 2 and what you're given 1. So it is like almost more of objective thing, and I don't think the individual examiner's preference may not have much influence.
Yeah, and even if one examiner is strict, still you have 9 more stations to recover. So it's a way of balancing act. Okay, so if everything is fine, we are always in the group. You can always post your doubts in the group whenever you get. So we are happy to help you out. Okay, and start practicing. Have a group with you. Start practicing the scenarios. We have our YouTube videos. We will share it in the group. You can look into the videos and understand how it is done. And if you want to practice with us, we are happy to help you out. Do reach us. Thank you. Thank you. Thank you, Dr. Sabri. Thank you,
Thank you, sir.
Thank you, Dr. Prasanna, for joining early. And thank you, all the candidates. We wish you all the best for successful MRCPCH exam. Thank you.
Thank you.
Yes. Thank you. I hope we are able to make some difference to you for your preparations. Wishing you good luck for your exams. Thank you all.
Sir, I have a question because I'm a very much I'm a beginner, so I don't
Okay.
have any knowledge the study materials. So I need to study some books. So from where I
I
do
think,
can.
yeah. So I think for the clinical exams, it's only mark. Okay. So you have an online copy of your mark in your iPad or pad of your phone. That's enough. It's more about practice for the clinical session rather than theory. Your theoretical knowledge will be of maybe, I would say, 20%. The rest 80 is about how we are going to communicate, how we are going to ask the right question, and how you are going to have a system of examination, how you are going to maintain your calmness. So those things will give you marks. Okay. Your listening skills and the way you're going to approach the patient, those things will get you marks. There's little room to ask theory question. Basically, if you see the time for asking questions with the examiner, even though in a clinical session it's only 3 minutes, so they might ask you how you're going to approach and how you're going to manage all those things. And by the time the 3 minutes is over, there's hardly any time for any specific dose or any specific drugs. There's hardly any time for those things. In video session, there is time, but it's only from the guidelines. Again, they are not going to ask you any specific dose there. Again, the approach is enough. So for that, the UK guidelines is available online for the video session. Apart from that, rest of the session, it's more about your practice and more about your skills rather than about your theoretical knowledge. And I would suggest you strictly to confine yourself to mark, okay, not beyond mark ability.
Okay, sir.
Okay,
Thank you, sir.
good luck. Thank you.